on to our next presenter, Taylor Bowser. Taylor, are you on the line? Is Taylor here?
Yes, I'm here.
Oh, okay. Taylor, thank you so much for coming with us today. Taylor is going to, I know you all hear that phone, and I am sorry, but again, I am having all kinds of technical difficulties today. But Taylor is going to talk about sickle cell disease, and she's a community health advocate with Indiana Hemophilia and Thrombosis Center. We had some great discussion about sickle cell disease and how that is an issue, of course, in underserved communities. And so Taylor, I'm very interested in your presentation. I'm sure we all are. If you could go on ahead and get started. Thank you so much.
Thanks for having me today. I'm excited to talk about it. And basically, I'm just going to go over some of the lesser known facts about sickle cell disease. I think there's a lot of misconceptions. And then we're going to talk about some of the challenges. Can you guys see my screen okay? All right. So real quick, what is sickle cell disease? It's an inherited blood disorder that affects the hemoglobin, and it causes the red blood cells to become deformed, and they turn a sickle shape or a crescent moon shape. And it is the most common genetic blood disorder in the United States. So just a real quick anatomy and physiology lesson. So why is sickle cell disease so serious or so problematic? And it all comes down to the red blood cells. So in people that have normal hemoglobin, their red blood cells are flexible and soft. They're a donut shape, and this allows them to flow easily throughout the tiny, tiny blood vessels that we have. And then in those with sickle cell disease, their red blood cells are quite the opposite. They're rigid, they're sticky, they're fragile. And with this shape, they get stuck very easily in the blood vessels, and they also don't survive very long. They break down very rapidly. So that's kind of what causes the anemia. And that's why sometimes sickle cell disease is called sickle cell anemia. So with those blood cells getting clumped up in the body, I like to call them traffic jams. They lead to what's known as a sickle cell crisis or a pain crisis. And the medical term is called vaso-occlusion. And it's the hallmark manifestation of sickle cell disease. And it's an acute episode of pain, and they're unpredictable. They can last anywhere from 2 days to 2 weeks, and they are excruciating. And it's the number one reason why patients go to the emergency department and are admitted to the hospital. And over time, these sickle cell crises can lead to organ and tissue damage just because the body the tissues and the organs aren't getting the oxygen that it needs to stay healthy. And unfortunately, these sickle cell crises are often unrecognized, underrated, and undertreated when people seek help at the hospital. So there's several other complications that are associated with sickle cell disease. I'm not going to talk about all of them today, but infection is a big concern, especially in our pediatric population, just because the sickled cells over time damage the spleen. And then stroke is another one that I want you to be aware of, because there's a very high prevalence of stroke just because the sickling and basically sickle cell disease affects every organ and tissue in the body, even the eyes. So sickle cell disease, we estimate that there's about 100,000 individuals living with the disease, 1,500 here in Indiana. We're not exactly sure how many people in Allen County, but we do know that we have the 4th highest population. It affects 1 in 365 African-American births and 1 in 16,300 Hispanic births. It can occur in any race or ethnic group, but it is most common in those who have ancestors that live near the equator, because sickle cell disease originated in Africa as a protection against malaria. So sickle cell disease is inherited through an autosomal recessive pattern. So that means that both mom and dad must have the sickle cell trait to birth a baby with sickle cell disease. And for every pregnancy, if both mom and dad are carriers, there's a 1 in 4 chance that their baby will be born with the disease. So more about sickle cell trait, we estimate about 8% of African Americans and 1% of Hispanics are carriers. And it is not considered a disease, and it rarely causes complications unless somebody would be under extreme conditions such as military boot camp training, or sometimes you hear about college athletes having issues with it. There are about 3 million individuals in the United States that do have the sickle cell trait, but unfortunately, the vast majority of those people do not know they have it. So this does lead to people, having babies and they're just shocked that their child has the disease because they had no idea that either of them had it. So sickle cell disease not only affects, a person physically, but it also affects them mentally and has a huge impact on their psychosocial functioning. So sickle cell patients do tend to miss a lot of work and school just because being hospitalized. And this can cause a great deal of strain on the family and caregivers because they have to miss work to take care of their loved ones. And sickle cell patients also suffer from lower quality of life, just experiencing the pain, and it's unpredictable, the anemia, which causes that chronic fatigue, and this does take a toll on your mental health. And sickle cell patients also do have a high incidence of neurocognitive impairment just because of silent strokes that many patients experience, and this causes it's very subtle, but it does lead to difficulty with processing and problem solving and math and reading skills. And then the one thing that I want to focus on today is kind of talking about the stigma that's associated with the disease. We often hear about stigma associated with mental health conditions, but it's definitely very common in this population too. So health-related stigma, it's being labeled or branded due to a health condition that you have. And in sickle cell disease, we know that the contributing factors are racism, healthcare inequity, lack of awareness about the disease, coming from lower socioeconomic status, and then using opioids for treatment. So the social consequences of stigma can be negative reactions from others, and this can be family, it can be friends, it could be coworkers, it could be healthcare workers. Oftentimes, sickle cell pain is discredited. People can't see the pain, so therefore they don't believe it. And people with sickle cell are so resilient, and they've learned over time to adapt and cope with it. They might not show that they're in pain, even though they're in excruciating pain. And then sometimes patients can be labeled as lazy or trying to get out of work or school. They may be underestimated by their teachers or viewed as incapable. They may have intimacy issues, or they may choose not to disclose their illness out of fear of being judged or just being treated differently. So the psychological consequences of stigma include chronic stress. Sickle cell disease is a very stressful disease to live with just because of how unpredictable it is. Many patients with sickle cell don't feel like they have anyone in their life that knows what it's like to go through it, just because somebody in school there could be not another student in their school that has it, so they feel like they don't have anyone to relate to, so therefore they internalize, and they might suffer from depression or low self-esteem, from feeling different, anxiety, anger, and in worst case scenarios, suicidal ideation and self-harm. So the physical consequence of experiencing stigma can lead to inadequate pain management because healthcare providers don't believe the patient when they say that they're in pain. It can lead to longer wait times when seeking care. So another patient might come in, for a broken bone, and they'll be triaged as higher priority than the sickle cell patient when this shouldn't be happening. Patients perceive this as being treated unfairly, and it can lead to, poor coping strategies and just worse pain. So some other healthcare related consequences of stigma: strained relationships with healthcare providers, distrust of providers. It can lead to patients not following treatment plans and just delay in seeking care or not seeking care at all. I found this quote and it just made me really sad. Every time it's a battle, nobody cares about people with sickle cell. And this patient was talking about what it's like for her every time she goes to the emergency department where she lives. So now I'm going to talk about some of the sickle cell health disparities. And access to care is a big issue. There are a shortage of providers that specialize in sickle cell disease, especially for adults. There's a lack of primary care physicians that have knowledge of sickle cell. There was a study that I read the other day that only 20% feel comfortable managing sickle cell patients. And there's also a lack of comprehensive treatment centers across the United States. And then health outcomes are much worse. Unfortunately, the average life expectancy for sickle cell disease for the most serious form, which is called SS, is about 30 years less than those without sickle cell disease. And then there's also lower rates of preventative care. So penicillin prophylaxis is prescribed to all babies. And so there's lower rates of that being used, lower rates of vaccinations, and then the screening, which they're called transcranial Doppler screenings, and those are screened for risk of stroke. And then sickle cell patients also have really high rates of readmission. They also get less research and funding compared to other genetic diseases. Cystic fibrosis affects 1/3 of the population of sickle cell, yet they get 3.5 times more funding from the National Institute of Health and 440 times more funding from private organizations. They have also had a lot more medications approved by the FDA, where sickle cell disease has only had 4, and sickle cell went many years without a drug being approved. And then pain management. Sickle cell patients are less likely to be prescribed pain meds. They're more likely to be labeled as drug seeking. There's just inadequate training about sickle cell disease in nursing school, in med school. And then there's a lack of just standardization in pain protocols within hospitals. So now I'm going to switch gears and kind of talk about what our organization and the other organizations such as Martin Center Sickle Cell Initiative and the Indiana Department of Health are doing to kind of bridge some of those gaps in care and lessen some of those barriers and challenges. So I'm going to briefly discuss some of the programs here. So Sickle Safe is our program for newborns up to age 3, and it's newborn screening follow-up. So we work very closely with the Indiana Department of Health, and we provide care coordination with primary care doctors and hematologists across the state to make sure that babies get the care that they need to stay healthy and prevent problems. Our sickle cell care coordinators provide initial and ongoing education with families through home visits and via phone. We also provide a free 3-month supply of penicillin, provide heating pads and thermometers, and provide basic inheritance counseling. Our next program is for children ages 3 to 21, and it's called SCORE, and we provide continued education and care coordination for the families that we serve. One of the services that we provide is we help advocate for students so they get the accommodations that they need at school to be successful, so 504 plans, IEPs. We assist our teens and adolescents moving from pediatric to adult care. It's called our PATH program. We host a lot of community events. We provide education to providers, and we host outreach clinics for sickle cell patients that live in more underserved areas such as Gary, and we've expanded to Evansville. And then we also collaborate with Lutheran Pediatric Hematology Clinic and meet with them quarterly to kind of give recommendations for sickle cell care. So Cascade is our newest program. We're really excited about it. It's for adults. It's the first program for adults in Indiana. And the goal was to kind of improve quality of life by offering some of these services, such as career counseling, community health worker, which our adult community health worker is on the call, and she's going to speak after me. We provide assistance with medication copay and transportation assistance. We help make personal pain plans, and then again, educating providers about sickle cell disease. Here's some pictures of some of the other activities that we participate in every year. We have an annual sickle celebration that takes place in Indianapolis. We have a Sickle Cell Advocacy Day, and we also have an annual camp for for patients with sickle cell disease that takes place at North Webster. And then Path on the Road is our traveling transition program for our adolescents. So how can you and your organization help? Well, we ask that you advocate for sickle cell causes. One of the things that you can do is become a donor on the Be the Match bone marrow registry. Encourage African American blood donations. It's important for our patients to get blood that is a good match, and then just participate in events that we have going on. I know that Fort Wayne does normally have an annual sickle cell conference. We didn't have one last year because of COVID, but hopefully we'll be able to have one in the near future. And also referring patients or your clients to our programs, become one of our sickle cell partners. We're always looking for allies. And then participate in sickle cell disease educational sessions. We're specifically targeting college students so we can spread awareness about sickle cell trait. We like to talk to nursing students, residents, primary care physicians, and most importantly, emergency department staff. So I'm going to hand it over to Beverly. As I mentioned, she's our adult community health worker. I'm technically the pediatric community health worker in Allen County. So Beverly's going to share about what she does. And she's been around for a while. I'm kind of the newbie of the group. So Beverly, are you there?
I'm there.
Yes,
Can you guys
I
hear me? Hi, good morning. Can everyone hear me? Hello?
Yes, we can hear you.
Yes, we hear you.
Okay, you can hear me? Okay, wonderful. You did an awesome job. Thank you, Taylor. Everyone this morning did a great job. And again, we would like to thank the group for allowing us to come out. It's just an awesome time for us to get together and just share ideas. So we just feel so grateful to have this opportunity today. And we want to thank you all. And just, I feel kind of inadequate going behind everybody. So I'm really kind of shaking, okay? But I like to say, kudos to you all. I'm with the Martin Center right now, and we're doing a lot of, the Martin Center is just an awesome, awesome group to be a part of. I'm just so excited to be a part of the Martin Center. I don't have enough time to even begin to talk about some of the things that the Martin Center do. But one of the, they're involved with community conferences that they've been doing for a very long time. I'm going to quickly try to talk about and dance about a lot of things that they've been doing, and I will go into some of the different things. But this is Gary Gibson. If I can show you a picture of him, and he's our CEO. And this is one of the state representatives, Gregory Porter. My apologies, guys. I don't know everyone here. Can you hear me?
Are you trying to share your screen? We're not seeing what you're seeing. We don't see these photos.
You can't see my screen. Okay, thank you very much. Let me get back in over here and see if what I didn't do. Okay. Okay, but okay, so I got the some information here I was trying to share with you all in regards to the Martin Center and things that we're doing here. Okay, but some of the things that I was trying to talk about is that they do a sickle cell. I've had some technical issues trying to get everything going this morning too, so I apologize. But they do a sickle cell celebration every year, okay? And that is something that is very awesome that we do. I don't know if Taylor can get that up or not. Yeah, it looks like mine is just not going to that PowerPoint that I had up there. Okay, so let me get back to it. So one of the things they do is that we try to educate the community about what's happening with us, okay? And so we do a sickle cell education. We have the state representative, he comes out and he helps out with different functions that they do, but it just depends. Their job is to educate, have doctors and different things come out. They do a 5K walk, and that's a part where the community can get involved with the 5K walk that is put on each year. And we can have people as far as from Fort Wayne, Indiana, come down to Indianapolis and take part of it. And Taylor, have you been involved with any of the 5K walks that they had did in the past? Are you still with us?
I participated in last year's, but virtually.
Okay, virtually. Okay, well, still you had the opportunity. Okay, well, they're real fun walks that they do. And everyone, if you can't go to Indianapolis, you can still participate by donating in the walks as well. And it's the different links that you can join in and participate as well. And that helps out so many of the clients here in the Fort Wayne surrounding areas. They have one of the things, Martin Center is a full service support center for everyone. And by it being a full service support center, I don't know what you guys are seeing up there right now, so you're probably not seeing
No,
too
we're
much.
not seeing anything, Beverly.
Oh,
but-
I'm
but
so
No,
sorry.
that's okay. That is
I'm
quite all
so
right.
sorry. I'm trying to get back there. Okay. I'm
Hey,
back
Beverly,
here.
we do only have a couple minutes. Let me ask
Yeah.
you just a couple of questions, because I know, like you said,
Sure.
you've been in the game quite a bit, a long time here. So you're talking about the Martin Center. Where is this center?
Okay.
Where is
We have
that?
we're a satellite. They're opening, it's here in Fort Wayne now. The corporate office is in Indianapolis, Indiana. But they do have a corporate office, and it's getting, we haven't found the location, but we're working satellite from our homes right now.
Okay, and you're serving adults with sickle cell disease in the community?
That's correct. That's
Okay.
correct.
And how do you serve them? What do you do? What are the services you offer?
Okay, that's what I was getting ready to get into. We offer support to them and referrals. We have support as far as let me get back to mine. We have different referrals that we refer them. We get them associated with different doctors if they need that type of support. We have if they need transportation assistance, we provide that. Sometimes they may need co-pays with their medications. It's a full service. So whatever type of assistance, we have food pantries, we have a gator closet. So whatever assistance they need, we're there to provide it for them, even personal assistance at that time. But that is depending on what the situation may be.
Awesome. One of the interesting things that I found or that I saw with Taylor's presentation and in talking and listening to some of the great things that you're doing also, Beverly, you said that the life expectancy for people with sickle cell disease is 30 years less. Did I hear that correctly?
That's very correct.
Wow. Are there, and you also talked a lot about implicit, the bias and things that they suffer with regard to not being treated as well in the medical industry. Are there things that can be done so that the life expectancy can be lengthened, or is it just strictly a physiological issue or physical issue?
Do you want me to take that, or are you going to take that? We finally, for decades, there have not been any medications out there for sickle cell patients. And that has been the biggest problem that has been going on. Up until recently, there have begun to have medications for the patients. And so finally, this is the beginning step for our patients. Up until recently, the only thing they had was pain pills. And that's why the medical community were trying to say they were substance seeking clients, substance seeking patients, but that's all they had to offer them. So it was really very upsetting to me that you're saying they're substance seeking patients and that's all you're giving them for their pain.
Okay.
Is that better? Can you define that a little bit better, Taylor?
Yeah, I agree with you, Beverly, that there's just a lack of like what we call disease modifying treatments. And there's a lot of clinical trials right now. So hopefully that'll change in the future. But I think it's just, I think a lot of it is just lack of specialization. There's in Fort Wayne, there are hematologists, but their specialty isn't sickle cell disease. We're like in Indianapolis, where I work, the doctors actually, they only treat sickle cell patients.
We don't have that.
That is definitely a contributing factor. And just a lot of sickle cell patients, they give up with trying to seek care because they feel like the healthcare providers don't understand the disease. So many of them don't go to the doctor at all. Or if they do seek care, it's just the emergency department.
Okay, wow.
That's so true.
Very interesting. Just one more question here in the chat from Anne. Does some of this information apply to those with sickle cell trait?
So this, what I talked about as far as like all the health conditions doesn't apply to sickle cell trait. The best thing would be to talk to your primary care doctor. I think there are, I've heard before that sometimes sickle cell trait can affect the kidneys. At the top of my head, I can't think of what it's called, but normally with sickle cell trait, there aren't any complications as long as like when you're engaging in physical activity, you're staying well hydrated, you're not climbing mountains. And usually if there's any complications, if it's very strenuous activity like college athlete training and boot camp and stuff like that.
And how many people in the community did you say sickle cell disease affects?
Sickle cell disease or sickle cell trait?
I was going back to your sickle cell. Maybe you should tell me the difference. I'm not sure
So sickle cell disease, I think there's about 40 or so pediatric cases in Allen County, but I may not know about all of them. And we guesstimate that there's probably about 100 adults. But we recently got a grant from the CDC to do sickle cell disease surveillance, which is really exciting. So once we figure out where all the sickle cell patients are, it'll be helpful to, get better care for them and those sorts of things. So that's a brand new grant that we just got this year. So we're really excited about that. And one positive I did want to share is that we found out that sickle cell disease is the first disease that's going to be eligible for the COVID-19 vaccine. So out of all the chronic diseases, sickle cell disease is number one. So we're thinking that those patients will be eligible starting in March. So that's really good news.
Okay, interesting. That is good news for sickle cell patients. And we have Kalila in the chat saying that her son has sickle cell. Her daughter has the trait along with me. Kalila, are you involved with any of the organizations or the programs that was mentioned today?
No, I'm not involved in any of the programs. My son is, however, he lives in Indianapolis. And one of the things you were talking about, the women presenting spoke to, the children with sickle cell. My son was roughly 6 or 7 years old when he was diagnosed with sickle cell disease. Fortunately, his father worked we were in South Bend, Indiana afterward, and his father worked at the hospital. And they then kind of stepped up because he was, family, to St. Joseph Hospital in South Bend, Indiana. And so the doctors really did a lot of good research in order to try and help my son. And I never knew that there was any disparity that I'm hearing now because of how his circumstances were handled. So this is very new to me. To see this and hear this is very hurtful because that hospitals and doctors are not taking this so seriously. I never knew that, never experienced that. I've always been involved with his medical up until he was, basically married. And then I told his wife, this is what I've been doing all along, monitoring, and now it's your turn, Yeah. But I'm so happy for this information, really, and I'll talk with him and ask him, how involved are you in this, and if he wants to get more involved in Indianapolis, with all the knowledge that he has, having lived with this all of his life, So thank you so much for this information. Appreciate it.
Thank you, Kalila, for being on today. We appreciate that personal, experience that you bring. So we're glad that you joined us. All right. If there are no more questions for Taylor or Beverly or Shanna, we're going to move on to our partner news. Going once, going twice. Anne has her hand raised in the video, or is she saying going, gone?
No, I had my hand raised.
Okay.
CTN is having a really fun fundraiser on March 17th. It's over lunch, and the theme for it is going to be the show The Office. And People can join as an individual. It's trivia. You can join as a team, and you can join with or without having lunch delivered to you. So it's going to be super duper fun. You can get tickets on our website.
Okay, so Ann is moving right into the partner news. And you said,
Oh, I thought that's what you were doing. I'm sorry, I missed.
No, we're good. We're good. That's a good segue. CTN is having, and we're all invited, you say?
Yeah, you can get tickets on our website. It's a trivia. Should be a lot of fun. There's gonna be some special guests.
Okay, wonderful.
Yeah.
So you're going to put that in the chat for us, Ann?
Sure, I'll get a link right now.
Okay. All right. Who's next? We're in the partner news. Jan.
Hi, everybody.
And hold on just a second. Hold on just a second. We got some feedback in our survey. When you introduce yourself or when you're saying something, please say the organization that you are affiliated with. Right? Okay, so everybody doesn't know. Go ahead, Jan.
Hi, I'm Jan from Parkview Community Nursing. Just want to let you all know that beginning March 11th, we have a new Freedom from Smoking clinic that'll start. It's a 7-week program. Participants will quit at week 4. It is a virtual clinic or program, and it's from 3 to 5 in the afternoon. And you can call 266-6500, which is the Parkview Center for Healthy Living, to register if you have more questions, and I will put that in the chat box.
Wonderful. Thank you, Jan from Parkview. Yes. And as you all know, we usually go to 11:15 so that we can get some additional partner news in. So we've got a few more minutes to go. Who's next? Shepherd's Hand, Rachel.
Yeah, so hi everyone, I'm Rachel Joseph from the Shepherd's Hand Community Outreach Center. And we have a couple things that are coming up. I will first highlight though, this last Saturday we had a great turnout. Many of you were exhibitors, helped get the word out. Sharon and Carla and Gabby from Health Visions were here with us for our health fair, our first health fair of the year. And we were able to hand out almost 5,000 diapers. We still have a ton left over, so we're starting to plan for our April health fair. So if your organization is possibly interested, we do have limited space and we do try to have a mix of exhibitors so that there's a wide range of organizations that directly fit with some of the feedback we've gotten from families who do come. So it's not necessarily completely wide open to any organization, but if you are possibly interested, please get in touch with me. I'll put my contact information in the chat and we can talk about if your organization might be a good fit for future events for our health fair and our diaper giveaway in April. So thanks to everyone who helped with that. We also have our first fundraiser coming up in May, our May 15th 5K. So our board is working to get plans together for that. So if you are interested to run or walk, like I will probably be walking, please save the date for that and let me know if you want to get more information about it as the day gets closer. And the last thing I'll mention is just that we are continuing for the rest of the school year to have Tuesday after school tutoring from 3 to 5 or 2:30 to 5. We have a student who started coming earlier. So if you know students in grades 1 through 8 who are just needing some extra homework help, please get in touch with me and we can talk about how we can best help them.
Wonderful, Rachel. Thank you so much. And there is a wonderful story about Shepherd's Hand Community Outreach Center in the Health Visions newsletter this month, which dropped in your inboxes yesterday. So if you haven't taken a look, you better go on and search that and check your junk folder if you don't know what I'm talking about, because it should be in there. I want to mention just before I see there's another hand up, but I do want to mention what I talked about earlier is that we did get the survey. Thanks to all of you who took our survey and gave us some feedback about the Allen County Health Disparity Coalition. We will be using that information going forward. There were a number of you that signed up as interested possibly in our advisory council. I will be connecting with you so that we can get together and talk about some things. I'm excited about the future for the coalition and some things that we want to do going forward and the input that you will bring with that. I do want to say that next month, like I said, I heard you wanted more talk time. Although I have a hard time getting people to talk when the talk time comes. But you said you wanted more time to talk and connect. So I'm going to give it to you. Beginning next month, we are going to have significantly more time to network virtually and to hear from you guys and to see what's going on with your organizations. We may do some different things to make that fun and enlightening for all. And also, dues are coming up. I've held off on dues for membership with the coalition because I wanted some feedback, and there's some things that might be changing due to the pandemic and virtual and the name with health equity versus health disparity and all of those things. So I kind of held off on that, but you will be getting some information about membership dues and what that will mean and entail for you. So with that said, any questions for me? All right, like I said, we do hang on till 15 after, so we have a little bit more time for partners. Kalila, you have your hand up?
Yeah, thank you, Sharon. I'm just wanting to mention, I'm Kalila Hanan, by the way, with the Center for Nonviolence. We have an advisory group, PADAC, which is People of African Descent Advisory Group. We're going to be having a series of what we call family meetings. And this is, our first one is going to be March the 25th. And it is going to be via Zoom. I'm relatively certain of it. And it's going to be in regards to mental health, the mental health disparities among Black families and the communities. So we're looking forward to having, again, a whole series of this is going to be happening quarterly, basically quarterly. But this is the first one of the quarter happening on March the 25th. And let me see, I probably should put one of my co's emails into the chat so that you'll be able to kind of touch base with them. We'll have panelists on as well. We're going to have Dr. Justin McGee, Pat Turner, Pat Veazey, Courageous Healing will be with us. The Society for Black Mental Health Professionals will be with us. Dr. Diana Jackson will be there, and also Jamal Brooks and Gina Brownlee Brooks will be there from Genesis Outreach. So we're looking for a good turnout on that. Black folks' mental health, especially in this climate that we're in with the COVID-19 and all other kinds of chaos that's going on in our country right now. Thank you.
Thank you, Kalila. Kalila, is this your first time with us?
It is my first time with you all, and I'll be the representative from the Center for Nonviolence. You know, we had some adjustments, and we have in our organization where persons will, from different representatives from different programs, we kind of switch back and forth and around into the different communities, organizations as representatives. And so this is my turn to do neighborhood health coalitions, to be with you all.
Well,
so,
wonderful. Thank you so much for joining us.
And that's my introduction, by the way.
Okay. Thank you. Do we have any other first timers that are still with us? Okay. Everybody else here is either a first timer or too shy to say that you are. All right. So I've got a couple of announcements I see in the chat. Katie from Neighborhood Health, it says that Neighborhood Health has started a vaccine clinic. The vaccines are available to people 60 and older at the Calhoun office Monday, Tuesday, Thursdays, and Fridays, and East Paulding on Wednesdays. You all see that. Pat, you say Tobacco-Free Allen County is offering virtual presentations about the dangers of smoking and second and third hand smoke. Anything else to add with that, Pat?
No, just that we're available. Just contact us.
Okay, Jan, you talked about your smoking, freedom from smoking program, correct? Or is that a different program than what you talked about earlier? Well, it's in the chat. So the information is right there. Let's see here, Joellen Lukomsky with Brightpoint. We are hiring. Brightpoint is hiring, guys, for a few positions in their in our department, outreach and enrollment coordinators and a QA specialist. So all the information is there. That could be some good information for people looking for work. And Rachel, you've got your information in there about the April fair that you were talking about. Anyone else? All right, good people. Thank you so much for joining us this month. We will be back again March 25th. It's the same day of the month, March 25th at 10 a.m. virtually with something exciting. I say that just to say that, but hopefully it will be exciting for you and some news. And you'll be getting some news, like I said, about the coalition and membership and what that all entails in your inbox. So stay watching for that. Thank you so much for coming. We'll see you soon. Bye.
Thank you. Thank you.